If a husband abandons his wife after she tests positive and he doesn't test positive, is the husband, the wife, or the person who gave the HIV test accountable?
That is one. It's still, honestly, that one is still a debate.
What would you comment on these factors known to cause false positive results on HIV antibody tests? The three of them are TB, malaria, and pregnancy.
All I can say is that I've heard about it, but I can't comment much. I cannot.
Mary Kibwakali is expecting her second child in a month. Her husband Henry told us, "We have a girl, and we're hoping for an heir." As for the AIDS tests,
I'm not worried. I don't fear anything.
good luck to you. But luck was not with Mary.
You are HIV positive, and the husband is HIV negative.
When Henry heard that his wife tested positive, we could see him pull away from her. He didn't comfort her when she cried. Mary doesn't speak English, and Henry made it pretty clear their marriage was over.
I fear, and I will not be very comfortable to sleep with her.
The disclaimer for the ELISA test states that at present there's no recognised standard for establishing the presence or absence of antibodies to HIV in human blood. And the disclaimer for the PCR on the first paragraph, not intended to be used as a screening test for HIV or as a diagnostic test to confirm the presence of HIV infection. So again, these are surrogate markers that are perhaps completely inconclusive. This is the original operator's manual for Western blot from Mengo Hospital, and it says that the clinical indications of antibodies in asymptomatic individuals are not known.
akawuka kamukenenya okuweerere nga tunakusanga ng'olina akawuka kamukenenya nkwenkakasa nti onna tulirina mu bujjuvu tujja tukuwa obwereere singa naawe onoofaayo n'ojja n'otwewa n'otatulimba kubanga okulimba kibi nnyo eŋŋamba tuwa amazima okuleka okwejaajaamya sinukuma okwejajaanya mukenenya agenda kukwata abaana n'abazzukulu nze ŋŋamba kigwenze nange abategedde nti okwetereeza kyensonga kyangu olwaleero akawuka ka mukenenya ddala mu butuufu gyekali mukenenya tta mukenenya bw'otemujjanjaba ddala mu butuufu.
They're advised to test, and then if the result comes back negative, they're diagnosed with TB, they're given a treatment presumably, and then told to go home and they get better. But if another patient presenting with the same symptoms clinically also advised to test and the result comes back positive, he's given a different diagnosis and prognosis.
Okay, what I've seen, what we do, you come in with the same symptoms, maybe of TB, that one is HIV negative. We cancel and then treat TB. That one who is HIV positive and has TB, the management is kind of different because once they have TB, they are most likely eligible to ART.
Why would they want to do that? Because taking ARV is always recommended for life.
Yes, but you know,
And accompanying that is the prospect of not being able to have a partner or children or a job ahead, in the future.
but you know, if they come in and they are positive and they have TB, depending on how sick they are,
Yeah.
the management is different. If they test positive, CD4 is about 700, 600, but they have TB. You treat the TB and put on separate prophylaxis. But if they have TB and CD4 is about 200, you're going to treat TB, and after 2 months, you're going to start ARVs.
This is on the basis that a low CD4 count correlates with increased viral load. But studies have shown, from what I've read, that decline in CD4 counts has nothing to do with viral load, but maybe everything to do with immune deficiency. And this is revealed when TB patients who test negative have their CD4 counts measured. But they also have a decline.
Which is very true, and which you have a point there, which you definitely have a point there.
What then becomes the deciding factor as to whether someone has AIDS or TB, considering that 50% of AIDS cases in Africa are TB patients?
You do the test, you do the HIV test after doing the TB. You do the HIV test, and you do the viral load as well. And I've seen what kills people the most. It's not the ARVs.
It's the stress.
It's the stress. It's the stress.
I've been trying to find out from the Ministry of Health yesterday what the definition of AIDS is in Africa. And the one for sub-Saharan Africa is based on 4 clinical symptoms. Still, is that correct? And no test necessary. Called the Bangui WHO case definition.
The one we get, we do get it from WHO. And that's the one we use.
Does it still apply?
Yes, it does.
I'm thinking is that there could be another factor that's causing some medicated patients to live longer than other medicated patients.
Maybe.
And could it be the food that's given?
There could be other factors you can explore. The peer support.
Yeah. Have you ever come across video footage of testimonies of people who tested positive 10 and 20 years ago? They've just lived normal lives without fear of HIV, no stress, been married, had children, and not got sick and not taken ARVs. I've never come across it.
Because not many people who are like that want to come out and say it. Not because they are not there, and not because they are